Burlington is taking further steps to tackle its drug crisis.
Last night, city councilors on the Public Safety Committee made changes to a resolution that takes a closer look at declaring the drug crisis a public health and safety emergency. Our Lucy Kale breaks down what the resolution would do.
We've shown you the impact of the drug crisis in the city, including needles and other evidence of drug use in the Burlington area. At Monday night's Public Safety Committee meeting, councilors discussed changes to a resolution that would help solve that crisis. First responders and EMS work to help save overdose victims. As the city says, by September, the Burlington Fire Department has already responded to a record 386 overdoses so far this year.
I think it is important that we proceed with this resolution with the urgency that is commensurate with the urgency of the incredible public safety crisis that our city is now facing.
At its meeting Monday night, the Public Safety Committee made changes to a resolution to tackle the drug crisis in the area. Most of the changes were minor language ones, keeping much of the original resolution the same. The resolution adds discussion of the issue to every city council agenda. City Councilor Milo Grant saying it has not been talked about enough.
And we need to have an item for each meeting so that we are properly informing the people of Burlington. Where do we stand in terms of data around the amount of overdoses, the amount of money that we are spending?
The resolution also asks neighboring communities to urge the Department of Health to disperse opioid settlement money allocated by the legislature. The money would go towards providing care, treatment, and harm reduction interventions for drug users. City councilors want the people of Burlington to lobby for the money since they say the state has not taken the steps to do so.
The state of Vermont has not acted with significant urgency to embrace all evidence-based harm reduction on the statewide level.
The committee also wants to hold 2 public forums to allow community members to learn from harm reduction specialists. And the resolution also asks the governor and members of the legislature to witness the crisis themselves in Burlington. Lucy Kale, Channel 3 News.
And Lucy joins us now in the newsroom. Lucy, part of Burlington's plan asked for more money from the State Opioid Settlement Advisory Committee. What do you know about that?
Darren, we know Vermont is set to receive more than $100 million to fight the opioid crisis over the next 15 years, and the Opioid Settlement Advisory Committee is responsible for deciding where the money goes. The money comes from a number of settlements with major opioid manufacturers and pharmacies. The committee is chaired by Health Commissioner Dr. Mark Levine and includes state lawmakers, other doctors, recovery specialists, and various town leaders. The group has been meeting almost monthly since last year, hearing from outside experts and folks from out of state who also are working on getting a handle on the opioid crisis. I spoke with Burlington substance use policy analyst Scott Pavick, who is also on the committee, about why this money isn't getting out of the door quickly.
It's slower than anyone would like, but certainly we've started to spend the money, and we are learning just sort of what wiggle room, what creative opportunities might be afforded to municipalities.
Out of the millions of dollars Vermont is set to get, Pavick says only about $200,000 has actually been paid out so far. Reporting in the newsroom, Lucy Kale, Channel 3 News.
Lucy, thanks.